Janet Woodyard. Welcome to my office. Come on in. Please stay tuned because I am going to be here live to answer all of your questions with a live Q&A. So if you think of questions during the event, write them down and then send them on in. And don't forget, at the end, you're going to receive a text. You want to respond to that text so you can come in for a complimentary consultation and also our introductory promotional price for Daxxify. So don't forget, answer the text. A neuromodulator is basically a botulinum toxin substance that weakens or paralyzes muscles to get rid of wrinkles. It's used commonly in the corrugators between the brows, along the forehead to get rid of forehead lines, in the crow's feet area, and it can be used to shape and change the appearance of the lips. It works very differently than fillers. There are many different brands of neuromodulators, but Daxxify is the newest one, and this is the one we're so excited about. It's one of the first changes in plastic surgery for many years. It's been in research and development for over 20 years, and it is powered by a peptide, which is different than the other brands of neuromodulators. You may recognize the names Botox, Xeomin, Juvo. Daxxify is a little different. It's powered by a peptide, which makes it adhere to the cells longer, and that's why it lasts for a much longer period of time. Daxxify is different than the other neuromodulators or the neurotoxins that we've been using for many years in plastic surgery because it's powered by a peptide, and that makes it adhere to the cells longer. So the median duration of activity of Daxxify is 6 months, which is on the bell curve of the reactions that people see, the time courses. The median duration is 6 months, whereas all the other ones, the median duration is 3 months. So some patients may even get 9 months from the Daxxify. So it will probably decrease visits by about half, and that's what we're really excited about. Neuromodulators like Daxxify treat lines that come from muscle activity. The biggest one is the corrugators when you frown. I can't frown because I have Daxxify in there, but it gets rid of the 11 lines between the brows, and that activity, that muscle pulls the eyebrows down. Crow's feet, which a lot of us have, if you relax those muscles, it lets the tail of the eyebrow come up. So when you treat these two areas, we get what's called a chemical brow lift. People that have lines across the forehead, you can relax those lines so the forehead is smoother. You can treat the downward lines that pull the lips down, that create lines in this area. You can also raise the lip up, what's called a lip flip. You can do that. You can raise the cheek up by injecting along the jawline. You can even relax the platysma muscles there that cause banding. So all of these areas we use for treatment with Daxxify. The onset of Daxxify, once it's been injected, can be seen as early as the next day. That's been our experience, that people are starting to see the weakening of the muscles within a day. Most neuromodulators, including Daxxify, will take about a week. The big difference with Daxxify is that it lasts twice as long as all the other ones. The peptide that's used with Daxxify to help it last longer, now people are seeing with more widespread use that it adds a glow to the skin. And we know that peptides are important for skin health, but as centers are using Daxxify more and more, they're beginning to see that. So they're actually starting some studies to see how that affects the appearance and the overall glow of the skin, which is an extra benefit. And don't forget, Mother's Day is around the corner. This is a great gift to your mom or yourself. So you look fabulous for Mother's Day and all summer. All right, we're gonna do Stacy's Daxxify today. So we're gonna clean her skin off, get makeup off. All right, and we're going to treat her corrugators. So let me see you frown, look angry. We're treating these muscles here, and then go ahead and smile. We're treating the crow's feet there. So it's 5 injection points. And the same thing here. And then go ahead and wrinkle your nose a little bit. You want to get these bunny lines here, so relax. That's the procerus muscle. So we like to relax that too. These muscles are all kind of working concert in this area. And most women don't like that, those lines, but that also pulls the eyebrow down. These muscles pull the eyebrows down, so when you relax them, it lets the brows come up and it gets rid of the lines. So you can relax and turn this way. And it's usually three little injections from there. Unless somebody has lines that extend down lower on the cheek, sometimes I'll do 4 spots, but usually 3. And this, we're just weakening this orbicularis muscle. Let me see you smile again and relax. Stacy will stay upright for 4 hours. You don't want to lie down because you don't want this to radially deviate and get anywhere near the levator muscle here that opens your eyes. We don't want it to get in there and weaken the eyelids. So you stay upright for 4 hours. She won't rub this area. And then tomorrow she'll go back to doing everything that she normally did. And this will start to kick in usually within a couple of days. And it can take, any neuromodulator can take 7 to 10 days to see the full effects. But Daxxify supposedly starts to kick in within a day or two, so she'll start to see weakening of the muscles, but it takes a little bit of time to see the full effect. And that's all you do.
Hi, I'm Stacy. I'm the esthetician here with Dr. Janet Woodyard's practice, and I was injected with Daxxify several weeks ago. Super happy with the results. It seemed to kick in a couple of days. No bruising, and as you can see right here, I can't scowl, and then when I smile, I don't have any lines or wrinkles right here on the corners of my eyes. Super excited with the results, and definitely going to stick with this neuromodulator in the future. And also the best part is it lasts for 6 to 9 months as opposed to 3 months. So very happy with the results. Thank you.
Thank you for joining us tonight, and stay tuned for our live Q&A about Daxxify. Hi, we hope you enjoyed our event. We're going to run through some questions right now. Lisa's going to read the questions and then I'll answer them. And if you have any questions, just type them on in and I'll be happy to answer.
Okay, we're going to start with the first one. So, do I have to wait for my Botox to be completely gone to get Daxxify?
You don't have to wait for it to be completely worn off, particularly if you're trying to get rid of lines. Some people have longer lasting lines. It takes several treatments to keep those muscles paralyzed. So the lines eventually fade and go away. So you don't want to let all the action come back into the muscle. It just reinforces those lines. But most patients will wait till they can start to see some movement or start to see the lines come back. That's usually the best time to do your next injection.
All right, so next question. What can I do to try to prevent bruising, especially around my eyes and crow's feet area?
Well, the most important way to prevent bruising is to not take things that cause the blood not to clot effectively. So aspirin, you really don't want to take before any injection, at least 10 to 14 days prior, because the effect of an aspirin will last for about 2 weeks. Motrin, Aleve, Advil, oh my gosh, fish oil, omega-3s, vitamin E. There are many things that cause the blood not to clot as readily. So if you stay away from things that will slow down the clotting mechanism, you'll have less bruising. The other thing is to not exercise vigorously and to not drink alcohol right after the injection. You can also use a little bit of ice. I don't mind patients putting ice on areas that are injected, except for the forehead. We don't want any manipulation of that area because of the other nearby muscles. But a little bit of ice is fine too. Most people don't have much bruising simply with a toxin because the needle is such a small needle.
All right, next question. I burn through Botox really fast since I am a runner. Will Daxxify still last longer for me?
It should. It should. It may not last the 9 months. For some very athletic patients, they do wear through their toxins quicker. But since the median duration of Daxxify is 6 months compared to 3 months for the others, it should last longer. But you may not be on the 9-month end. You might be closer to the 6-month end.
All right. Are there any restrictions, and can I fly the same day?
Yes, you can fly the same day. The only restrictions after any neuromodulator injected into the corrugators, that's the lines between the eyebrows, is to stay upright for 4 hours and to not rub the area. And that's just to prevent it from diffusing into the surrounding muscles. But that's really the biggest limitation, is stay upright for 4 hours, don't rub. I prefer people not vigorously exercise, particularly if you're leaning down, because then you're putting your head down. But those are the only restrictions.
All right. Can you explain a lip flip with Daxxify?
A lip flip is a newer use of neuromodulators to add a little bit of volume to the upper lip without putting fillers in. So a lot of patients, as they age, or if they just have hyperactivity of the muscles around the mouth, when some of these muscles contract, it actually pulls the lip down. So if you put a very, very small dose just along the vermilion border, it relaxes those muscles and it lets just a little bit of the lip actually flip upwards. So it has the appearance that the upper lip is fuller because you're showing more of the red lip. So it's a very more of a subtle way to add volume as opposed to putting fillers in, which also increases the size of the lips. It's a newer way to use any of the neuromodulators. A lot of people like it very much.
All right, next question. What are bunny lines?
Bunny lines come from the procerus muscle. So when we inject the forehead, and I can't look there and here at the same time, but we have lines that run up and down, and then we have these little transverse lines when you scrunch up your nose. And those lines, also that muscle is an up and down muscle. So when it contracts, it pulls the brows down. So most people talk about the corrugators, the 11 lines, but the other lines that are perpendicular along the base of the nose, we always like to relax when we put a toxin in that area. So those are the bunny lines.
All right. Will I need to wait at least 3 months from getting Dysport?
No, again, it's if it's worn off or is wearing off, it's important to be able to see enough movement of the muscle that I know I'm getting the proper area injected. So you want it to wear off enough that I can see the movement of the muscle. And most patients that get multiple areas injected, it will last a similar amount of time. So I just think it's most important to stick on the same schedule for all areas, to not come in and do the corrugators one time and then a month later do another area. It's important to do all of the areas you're going to treat so you stay on an even time schedule. But it should be worn off enough that I can see the muscles to make sure I'm getting a proper effect.
All right, next question. Are there any side effects with Daxxify?
Any toxin theoretically can have side effects. Patients can be allergic, very rare. I have only, in my practice in 30 years, had one patient slowly develop an allergy to a toxin. But any substance you inject, there can be allergic reaction. It's extraordinarily rare, to the point that we don't skin test or do any type of testing. That's the biggest type of side effect. It will paralyze or weaken any muscle you put it into. So it's very important that it's injected properly so you don't get the effects in a muscle where you don't want it. And it will interfere with the movement of muscles. That's what it does, that how it gets rid of lines. But if you inject around the mouth, say for a lip flip, or if you're injecting along the chin to get rid of dimpling of the chin, it can affect the posture of the lip. That's not really a adverse reaction. It's just an effect of it. So sometimes when you inject in areas where there is motion, Most people like the benefits of it, and occasionally people don't. I always recommend, if we're doing a new patient or an area that might questionably give someone a change in posture that they may or may not like, use our more conventional neuromodulators for the first treatment. And once they decide they like that, then switch to Daxxify, which is going to last a longer period of time.
Okay, another question. I built a tolerance to Botox and it only lasts 1 month. I get about 3 months on Dysport. Will Daxxify be affected by Botox tolerance?
It really should not. I have not experienced intolerance or a tolerance to any neurotoxin in my practice. I've never seen it. It's a very rare occurrence. And I've just never seen it. I've been in practice 30 years. This is attached to a peptide, which helps it to adhere to the cells longer. So it's functioning a little bit different than Botox and Dysport. So somebody that has a tolerance to it may not have the tolerance to this, because the means of the toxin adhering to the cells is totally different because of that peptide. So hopefully for all patients that have that tolerance problem, which is very rare, I think they might not get this with Daxxify.
All right, next question. How do neuromodulators like Daxxify actually prevent the wrinkles?
They prevent wrinkles by paralyzing the muscles or weakening the muscles. All of these are botulinum toxin, which is a paralytic agent. It's used in very small doses. In some areas, we're completely paralyzing the muscle. The corrugators, the 11 lines between the brows, we inject a sufficient dose that that area is still. So that's why you see the pictures of people frowning before and then trying to frown after, and the area is completely still. So we paralyze that muscle. And paralyzing that muscle, keeping that muscle from working, that's how those lines eventually, if there are lines etched in the skin, they will eventually disappear if the muscle isn't constantly contracting that area. Other areas, we just weaken the muscles. So if we're doing the forehead, if we're doing the crow's feet, we're not looking to paralyze everything. In those areas, we're just weakening the muscles, because these are very small muscles around the crow's feet area across the forehead. So we're putting in enough that essentially the forehead's not moving, but we're putting such smaller doses in that area. In the crow's feet area, even though at rest the lines may be gone, when you smile, pushes your cheek up, you'll have some lines there. But some areas we're just weakening, and other areas, like the corrugators, you're completely paralyzing. If you do them in the neck muscles, which I'm due for that now, I really need to get that done. We're just weakening again to try to just weaken the muscle enough that it'll come up a little bit and give a better contour.
All right. How long has Daxxify been in use?
Well, Daxxify has just been released in the U.S. I believe it was March that it was FDA approved and released. Most of these products have been in use in Europe longer, but in the U.S., I think the official launch date was actually March, and that's when we did, I think, you and Stacy, to get the benefits of it, to get some experience with it, and now we're offering it to our patients as of today.
All right, so we're taking any last minute questions, but in the meantime, did you want to go over what the special and the giveaway is going to be?
Well, we're going to offer, just like we did for the RHAs, we're going to offer 20% off for the month of May, and we will have a drawing. I believe we're going to do it on Monday once everybody has viewed the event, or if we have some latecomers that view it on YouTube. We're going to have a drawing on Monday, so someone will get one area treated for free, which is usually about 40 units. The dosing is a little bit different for Daxxify than it is for Botox, but 40 units is typically the number of units to treat the corrugators. If somebody wants to treat their crow's feet instead, they can. It's about the same amount of units. So we'll be doing that drawing Monday.
All right, so everybody's going to get a text after this video, so make sure to say yes to the text. That basically will give us the opportunity to give you a call and schedule you for your complimentary consult. And if you want to get your treatment done that day at 20% off, we can do it then as well. All right.
So let us know.
I think we're wrapping everything up.
We hope to see you soon.
Bye.